I offer patients three main minimally invasive techniques for varicose veins. The most common one I use is called endovenous ablation. And that's a technique where I put a needle into the vein under a local anesthetic, and I pass a probe up inside the vein. You don't feel that. And then I give some more local anesthetic to the tissues around the vein so that when I use the probe to heat the vein from the inside, you don't feel it. So that heat can be delivered either via laser or radio frequency, and the heat causes the vein to block off, and then the body reabsorbs the vein after 6 weeks to 3 months. So the vein remains inside the body, but the blood that was flowing the wrong way in the vein and causing the varicose veins is stopped, and it's like turning off a leaking tap. The second minimally invasive technique I use is foam sclerotherapy. So that's a direct chemical injection into the lumps of the varicose veins themselves. It's a detergent chemical that I mix with air, and using a very small needle, I inject the vein directly, inject the chemical, and then again, the vein blocks off. And after a few weeks, the vein gets reabsorbed, so you don't see the lumps at all. Lastly, I also perform avulsions under a local anesthetic. So that's a more surgical procedure where I make very small cuts, less than 1 centimeter long, and I hook the lump or the vein out directly. So the vein's taken out of the body immediately. There are very small scars, but they heal very well. And after 6 weeks to 3 months, you really don't see very much of them. And so all of these techniques can be done under a local anesthetic, and they can be done in the day surgery. So you walk in and you walk out with very minimal recovery time. So all venous surgery techniques are very safe. The risks are extremely low, but in my view, the most significant risk is that of causing a deep venous thrombosis after the surgery. So that's a clot in the deep vein. Thankfully, the rates are very low, and in my own personal series, the rates are less than 1 in 1,000 patients. So most patients have no problems after minimally invasive venous surgery at all. I would call them all very safe techniques. So most of my patients who I treat for varicose veins will require endovenous ablation, and my preference is to use laser, and then adjunctive treatment for the lumps or the varicose veins themselves in the form of sclerotherapy or avulsions. And I tailor my treatment to each patient's needs. Sclerotherapy does carry a small risk of skin staining. That's a brown discoloration of the skin. Although for most people it fades, if my patient's main concern is a very quick cosmetic recovery, then I might offer them avulsions as a way of removing the veins immediately. So the most common minimally invasive technique I use is endovenous laser ablation. And that's a technique that closes off the main truncal vein that is causing reflux. So veins normally take blood from the feet back up to the heart. They're the return pipe. But quite commonly, and in about 1 in 3 to 1 in 4 people, the valves in the veins aren't working as efficiently as they might. And so blood tends to spill back down towards the feet with gravity. And over time, the veins dilate, the valves become more inefficient, and eventually varicose veins appear at the surface. These are the lumps that you can see at the surface. In some people, then, we get complications such as dryness or itchiness of the skin, venous eczema, swelling of the ankle, discomfort, tiredness, or restless legs. In a very small number of patients, these symptoms can eventually progress into ulceration or wounds in the legs that don't heal. So to correct the primary problem or the feeding problem of the vein reflux itself, I use endovenous laser ablation. And that's a technique that I mostly undertake under local anesthetic. Put a needle into the vein, pass a probe up on the inside of the vein, and then heat the vein up from the inside using the laser. And that causes the vein to block off and stops the blood spilling down back towards the ankle. In addition, we can use foam sclerotherapy or avulsions to treat the lumps themselves so they are taken away and the cosmetic appearance of the leg also improves. So endovenous laser ablation is a very effective technique. It has closure rates of about 99% in the initial phase, and the recurrence rates, that is to say patients who come back with problems with their veins, are very low. It's around 5% at 5 to 10 years. So the prices range according to the size of the problem. So for thread veins or reticular veins, I can offer microsclerotherapy, and that costs a few £100s. For patients who have very established varicose veins and venous disease, they may require endovenous laser ablation with foam sclerotherapy, and they might require a second session of foam sclerotherapy. And that course of treatment can cost up to £3,000. Using minimally invasive techniques, I can get patients back on their feet almost immediately after their procedure. Everyone needs to wear compression stockings for 1 week, but most people are able to get back to their normal exercise, and that's running, HIIT exercise, playing tennis after the first week.